EROSION section is designed to help dental instructors and students assess the suitability of this program to their curricular needs. This instructional appropriate dental curriculum content areas: oral pathology, medicine, oral biology, health ecology, legal aspects of dentistry, and forensic dentistry. At the conclusion of this program, the student should be able to do the following: identify the circumstances which require correct identification of human remains. Describe a technique for analyzing changes in tooth structure to determine age. Indicate the procedures to be followed when attempting to identify an unknown body. Describe techniques which can be utilized to facilitate identification by dentures. Identify 2 techniques for determining the sex of an unknown body. Identify 2 techniques which should be used to determine blood grouping. Indicate characteristics of the teeth which will assist in the identification of the mode of death. And discuss how information derived about the unknown victim's socioeconomic status, race, nationality, and occupation can be utilized for identification. This is the first of 2 instructional units on forensic dentistry. Unit number 1 will present identification of human remains through the dental tissues. The second unit will cover identification of bite marks. This program is organized into 3 sections. Section 1 will describe the circumstances which require the identification of human remains through examination of the dental tissues. Section 2 will describe the types of information which can be derived from the dental tissues. And Section 3 will demonstrate the procedures which should be used when identification is based solely on dental tissue. There are a variety of circumstances which require the correct identification of human remains. These circumstances include criminal cases, insurance settlements, remarriage, identification of unknown bodies, and burial. Evidence in a criminal case may be dependent upon positive identification of the victim and establishment of the victim's relationship to the suspect. Insurance settlements are also dependent upon establishing the body's identification. If one's spouse dies or is killed, it is necessary to certify their death in order to permit remarriage of the survivor. Unknown bodies need to be identified and compared to a register of missing persons. Finally, presentation of the correct body for burial is often a problem in mass disasters or in the armed forces. When the corpse is in a preserved state, relatives or associates are able to make a direct visual identification. In addition, fingerprints, palm prints, or footprints can be obtained even though mutilation or decomposition has occurred. When conventional procedures are inadequate, the dental tissue can be utilized to establish positive identification. Circumstances requiring identification through the dental tissues include severe mutilation, which prevents visual identification, and finger or footprinting. Bodies that are burned to such an extent that only the hard tissues remain. and bodies found in varying states of decomposition. The teeth are the hardest tissue in the body and are protected by the lips and cheeks. For this reason, teeth are usually preserved and will provide a considerable amount of useful information even though the soft tissues are completely destroyed. Dental identification techniques will provide information in these categories: age, sex, blood grouping, mode of death, occupation and characteristic habits, incidence of childhood disease, socioeconomic status, race and nationality, and identity as indicated by evidence gathered from bodies with dentures. A basic category of information which can be derived through dental identification is age. From the onset of dental calcification, sometime after the 20th week of utero until permanent dentition is fully established, it is possible to determine age from the teeth. Unidentified human remains should be examined for the initiation of crown calcification of both deciduous and permanent teeth. The stage of crown and root development, and eruption into the mouth. Standard developmental tables for each sex can then be utilized to compare the unknown body's stage of development to an average stage of development. If a term fetus or neonate is involved, it is possible to be more accurate. At birth, a very prominent incremental line develops in the dentin. This is known as the neonatal line. The presence of a neonatal line indicates that the subject survived birth. In addition, the distance from the neonatal line can be measured, and the age in days from birth can be calculated. When dealing with the mixed dentition stage up to age 13, it is usually possible to age teeth to within 1 year. However, it should be noted that the published tables represent average values, and dental maturation can be slightly delayed for a variety of reasons. Once permanent dentition is fully established, other methods of determining age must be used. Several methods exist, but the one most commonly applied at present is based on the assessment of changes which occur in teeth with aging. The changes include the incisal and occlusal surfaces wear down, A. The dentin of the root becomes increasingly translucent due to increased mineralization of the sclerosed dentin, B. Apical migration of the periodontal membrane occurs with the exposure of the cementum, C. The root tip is reabsorbed, and both cementum and dentin are lost, D. Cementum apposition may occur down the root, and it is most prominent apically, E. And secondary dentin is deposited on the pulpal wall and slowly fills the pulp cavity, F. When whole and ground sections of teeth are examined for these 6 points, a score can be placed on each depending upon the degree of occurrence. In this case, the total score was 17. The score can then be compared to a standardized graph prepared from teeth of a known age. In this case, the age would be approximately 80 years. Using this technique, it is possible to determine age to a plus or minus 10 years with 95% confidence. Identification of sex from the teeth tends to be unreliable. Sex is more accurately identified by examining the remainder of the skeleton. However, 2 features are relevant when the amount of tissue is limited. First, in comparison to the male, female skeletal development tends to be more advanced than female dental development. Thus, a body with skeletal development ahead of dental development would be a female. Second, in adults, the female's teeth tend to be smaller than the male's. Although there will be exceptions to this rule, the length of the upper and lower canines exhibit the greatest differences between the sexes. Two techniques can be used to determine blood grouping. First, if a tooth is obtained in a fresh state, it is possible to remove the pulp and extract a sufficient quantity of blood to determine the blood grouping of the body. Second, if the individual was among the 80% of the population secreting ABO blood group substances in their saliva, it is possible to determine their blood grouping from saliva obtained from dental calculus or superficial scrapings of the denture. The dental tissues and blood vessels in the head can exhibit characteristics which will assist in the identification of the mode of death. In cases of death from strangulation or hanging, the blood vessels of the head become grossly dilated and frequently rupture. This leads to the appearance of petechial hemorrhages on the skin and oral mucosa. The vessels of the dental pulp may be similarly afflicted, and histology would reveal many dilated or ruptured vessels with erythrocytes lying freely in the pulp tissue. Spectrophotometric changes occur in the blood as a result of carbon monoxide inhalation, and these might be detected in a blood sample obtained from the pulp. In addition, the blood assumes a cherry red coloration in carbon monoxide poisoning and can produce the phenomenon of pink teeth with red pulp showing through the dentin. Certain occupations and habits are associated with characteristic dental appearances. Examination of dental calculus might reveal a high content of specific dusts, such as silica, charcoal, cotton, or other fibers, which could associate the individual with a specific occupation. Characteristic habits may also be a source of information. For instance, carpenters frequently hold nails between their teeth, which can produce a characteristic pattern of attrition in the incisal edges. Pipe smokers gradually wear away the incisal edges, often unilaterally. Pipe smokers and other smokers will frequently exhibit nicotine stains around the teeth. Workers in factories which use acids, such as in the production of car batteries, suffer from erosion of the enamel due to the high content of acid fumes in the air. The pattern of acid erosion affects the entire crown instead of just the incisal edges, as in cases of attrition. Mottling of the teeth occurs when the fluoride content of drinking water rises above 1 part per million. Therefore, an individual who spent his youth in an area with a high fluoride level will be more likely to exhibit dental mottling than someone who did not live in a high fluoride area. The occurrence of certain childhood diseases can be determined by dental identification techniques. For instance, childhood diseases such as measles, scarlet fever, and chickenpox can cause a band of enamel hypoplasia to occur along the parts of the crown which are calcifying at that stage. Careful screening of the medical records of possible victims or missing persons which indicate childhood disease could lead to a positive identification or eliminate certain individuals from consideration. The medical history would also reveal the administration of tetracycline for infections. Tetracycline is taken up by the developing tooth and can be visualized in a section of a tooth as it fluoresces under ultraviolet light. For instance, this child received tetracycline 3 times while his second molar was forming. An estimate of socioeconomic status can be derived by examining the quality of dentistry which the unidentified body received. This category of information can be used in conjunction with others to eliminate potential candidates from scrutiny. The dentition in this corpse reflects a high standard of care with crown and bridges. In contrast, this individual has old amalgam restorations, gaps, and teeth requiring attention, quite possibly a reflection of lower socioeconomic status or limited access to professional dental services. Thus, the quality of dental care can be used to eliminate potential candidates from consideration when dental records are available. It is not possible to make definitive conclusions about race from the teeth alone. However, certain trends are common in specific races. For instance, shovel-shaped incisors with prominent marginal ridges are more common in the Mongoloid races. In Negroes, the first mandibular premolar usually has two lingual cusps, a trait not found in Mongoloid races. The type of dentistry evident in the victim can be a clue to nationality, since certain restorative procedures are more popular in some countries than in others. For instance, multiple gold inlays, gold crowns, and swaged silver crowns are more popular in continental European dentistry than in British or American dentistry. Bodies found with dentures are generally more difficult to identify than bodies found with the teeth intact. However, information can still be derived from dentures. Acrylic dentures are resistant to decomposition and can be matched with dental records and models. The teeth in the denture should also be examined to determine if they are acrylic or porcelain. Porcelain teeth can be dug out of the base, and the manufacturer and tooth form can be identified by the number stamped on the tooth. The dentist and the patient can be traced from the manufacturer's number code. The base plate should be examined to determine if simulated veins have been added. This information can also help tracing the denture to a particular manufacturer. Repairs of the denture should be noted and matched with existing dental records. In some countries, notably Scandinavia, and in the armed forces, it is standard practice to identify dentures. This is accomplished during dental processing by inserting into the denture either a strip of paper or a stainless steel foil with the name or social security number indicated. The stainless steel foil will allow the denture to be visualized radiographically and will withstand temperatures up to 1600 degrees centigrade, sufficient to survive cremation. For these reasons, denture identification is strongly encouraged. When identification of human remains must be based solely on the dental tissues, the following procedures should be used. Perform a complete examination of the victim, including detailed dental charting, radiographs, photographs, and models. Compare the victim to existing dental records with respect to periodontal state, missing teeth, restorations, endodontics, and prosthesis. It should be noted that errors in charting do occur, and dental records can be less than satisfactory. Compare existing dental radiographs or skull radiographs with radiographs of the remains. Restorations form characteristic shapes and are quite individualistic in radiographs. Endodontic treatment will also show up in radiographs. Dental models from orthodontics and prosthodontics should be examined. If the hard palate is intact, it is important to compare the pattern of rugae around the incisive papilla with existing models, since rugal patterns vary considerably. If enamel hypoplasia or ultraviolet fluorescent bands in the ground sections of the tooth exist, the medical record should be consulted for evidence of childhood diseases and ingestion of tetracyclines. It should also be noted that teeth forming in the fetus will pick up tetracyclines given to the mother. If abnormalities of the anterior teeth are noted on the body, such as fractured crowns or a median diastema, old family photographs can be examined, or relatives and associates can be interviewed to verify the existence of similar abnormalities in missing persons. For instance, an identification of an unknown body was made by comparing this family photograph, which reveals a media diastema, to a model of the upper dentition taken from the body. When an unknown body is being examined, it may be useful to reproduce a careful dental charting in a professional journal in the hope that a dental surgeon might recognize the patient. To review, identification from the dental tissues is useful in cases where human remains cannot otherwise be identified. This program has described circumstances which require the identification of human remains through examination of dental tissue. It has described the types of information which can be derived from dental tissue, and has demonstrated the procedures which should be used when identification is based solely on dental tissue. The following points were emphasized. A considerable amount of information can be gathered about the victim from the teeth, and frequently this information is sufficient to make an identification of a human remains. Therefore, great care should be taken in examining the dental tissues. 9 categories of information can be derived from dental identification techniques: age, sex, blood grouping, mode of death, occupation and characteristic habits, incidence of childhood disease, socioeconomic status, race and nationality, and identity as indicated by evidence gathered from bodies with dentures. The identification procedures described in this program depend on the availability of accurate dental charts. Identification from dentures can be difficult. Insertion of the patient's name or social security number will facilitate identification.